All right, guys. So in this session, we just want to talk about the administration of salbutamol or Ventolin to a patient who has asthma. So one of the first things that we look at here is your spacers. Now, basically, a spacer assists you to get more medication into the patient's lungs. There are other uses for these, obviously. We have two types here. This particular type is an adult, and so this could be used over and over and over again until it's pretty much had it. There's no way of cleaning these, okay? This one here is a child, and in this particular one, you can take it apart, take it all apart, and clean it. Obviously, you need to be careful about what you clean it with in case it does trigger another asthma episode. With the child, we can also bring in something like a face mask. So this face mask can assist us in being able to administer our medication to our patient. I always say to mums, if their little ones who've got asthma, put that together, throw it in their toy box, and they can play with it, etc. So if they do, if they are having an asthma episode, and you go and approach them with this, it's not going to be frightening. They're already having some trouble breathing, some tightness in the chest, some wheezing, etc. And that can become worse and worse, obviously. So if we are talking about, administering our salbutamol to a child patient, these masks can be a lot smaller than this, obviously, so that's all available. But with our salbutamol, so what we really wanted to look at here is the application of our 4x4x4. So you've got a patient who we've run through the DRS ABCD, we have our patient's consent, etc., done all that. We're now going to position our patient in a position of comfort where they feel comfortable, etc., reassuring the patient. The patient breathes normally, so this is placed over their face and mouth, or a nose and mouth, and they breathe normally. As they breathe in and breathe out, they breathe in. As they breathe in, we're now going to trigger this off, and they will now take 4 breaths. Okay, so once they've taken 4 breaths, we're now going to press this in again, and they'll take another 4 breaths, keeping the mask over their face. And once again, after they've had the 4 breaths, we'll then trigger off again, and they'll breathe in and out 4 times. We're now going to wait 4 minutes, and if there's no improvement, we're going to repeat that until the ambulance arrives. That's our 4x4x4.